Hello everyone, my name is Hammoud. I'm the Chief of Medical Physics in the Department of Radiation Oncology at the National Center for Cancer Care and Research, part of Hammoud Medical Corporation in Doha, Qatar. Also, I am a MEFOMP Treasurer, and I would like to thank IDMP for this opportunity to present to you today Enhancing the Impact of Medical Physics in the Middle East. This is a MEFOMP initiative for building awareness and establishing collaboration across disciplines. I have to state that I have no actual or potential conflict of interest in relation to this presentation. So as Dr. Mshari and Dr. Hassan presented in their talks that we present MEFOMP. MEFOMP was established in 2009 with 12 participating countries. Our goal is to enhance the medical physics practice within the community. How can we do that? By spreading awareness through educational activities, for example, hosting webinars for regional and global visibility, executing workshops across the region. This is to build the skills and to expand the knowledge of the medical physicist. Also by promoting medical physics on key dates, and I will talk about that. So our ultimate goal is to define strategic goals for integrating medical physics into the healthcare and beyond healthcare. So a few years ago, MEFOMP decided to establish MEFOMP conference every 2 years. And this will focus on multidisciplinary within radiation medicine, radiotherapy, diagnostic and nuclear medicine. Also, we start to engage other medical specialties and allied health professionals, such as radiologists, cardiologists, and radiation therapists, nurses. And we try to invite international, regional, and local speakers in addition to student presentations from the region. Definitely, we engage the industry and the vendors and what we call them business partners, not just to support us financially, but also to share their latest technology. So we started this activity in 2021, and this was a virtual conference. We had more than 1,000 attendees virtually. It was an excellent program, well executed, and it was a great success. We continued this exercise in 2023 by physical, and we hosted this conference in the city of Muscat in state of Oman. There was a pre-conference, so workshops, so there were hands-on activities on treatment planning, for example, in radiotherapy, MRI, diagnostic radiology, nuclear medicine, and others. More than 300 attendees attended this conference physically and with well-defined parallel sessions. Next year, we're going to host the 2025 MEFOMP conference in the city of Kuwait, in the state of Kuwait. When we talk about other educational activities, we started establishing education activities, for example, at many institutions within MEFOMP. I'm giving you an example here at the National Center for Cancer Care and Research in Doha, Qatar, where we're hosting pre-med and med students from, for example, from Weill Cornell Medicine in the campus of Qatar. This is where they will observe. They will come and observe how we treat our radiotherapy patients, starting from the simulation. So they were observing the CT simulator, the MRI simulator, the treatment planning concept, to the delivery, such as on the TrueBeam, CyberKnife, and Ethos, the adaptive radiotherapy platform. What about webinars? We're hosting online webinar. Our target are regional and global audiences. This will increase the accessibility and the awareness of medical physics, and it's based on diverse subjects within radiation medicine. Our ultimate goal is to enhance the reach and the impact of the field beyond local borders. What about workshops? We have many workshops, and these were run and endorsed by MEFOMP, focusing on radiotherapy, diagnostic imaging, and nuclear medicine. And they were hosted in many countries within the region and also from participants from all these countries. So a few examples to list here. This is the workshop that was hosted in Doha, Qatar in 2021 on instrumentation and radiotherapy. Another workshop on brachytherapy planning on QA in Kuwait, CT workshop in Jordan, and others. And the goal is to enhance the medical physics clinical practice within the region. What about medical physics recognitions? This is an initiative from the IDMP. It's called IDMP Honorary Membership Award, and this is to recognize significant contributions to the objectives of the IDMP by persons who are not practicing medical physics themselves. So these are members within the region, within the globe, that they are supporting the medical physics community, but they're not actually medical physicists. And this is one of example. Dr. Noor Al-Hammadi, she's the chairman of radiation oncology at the National Center for Cancer Care and Research in Doha, Qatar. She's a strong believer in the medical physics and the medical physicists. She's a huge support to our medical physics community, and that's why she was awarded this award. Other ways of promoting the medical physics is by promoting them in some specific key dates, and this is what we call, for one of the examples, is the Medical Physics Day. This is where we're utilizing this day for publicity and engagement. We're sharing during that day success stories of our medical physics projects, activities. We are conducting educational content and activities, and most importantly, we're recognizing medical physicists within the region. IDMP, the International Day of Medical Physics Award, which is awarded for the physicist from the, for example, from the MEFOMP every year, in addition to some societies where they awarding also physicist of the year within their society. So this is the example of the IDMP, which was awarded to Dr. Mshari one of the years on his contribution to the medical physics practice. Dr. Huda Noaimi, other physicists from the communities also were awarded physicist of the year. We worked also on not just recognizing medical physicists, but also we went beyond medical physics community. We start recognizing other specialties and departments, these departments that support and facilitate our task as medical physicists. So we recognize HICT, the IT departments, radiology, anesthesia, facility, biomedical, and even finance, who support us in tendering in all the financial documents that are essential for our equipment purchase. And this is an exercise that we started, one example here in Qatar, and it was big success. It was well recognized by these departments. So our objective is to increase the public awareness and the appreciation of the community. So our ultimate goal is to define strategic goals for integrating the medical physics into the healthcare and beyond. And this is by integrations of medical physics into the multidisciplinary teams. This will play a role in advancing the technology and the software in the healthcare. We look at the big picture approach. This will foster collaboration across various medical practices, and the goal is to position medical physics as a crucial part of the healthcare ecosystem. What about engaging in non-clinical sectors? Our goal is engagement beyond the clinical settings, facility management, infection control, healthcare, bioengineering, finance, all these departments. We should be engaged with them, and our benefits will extend the influence of medical physics to support the broader healthcare infrastructures. So in summary, I would say our objectives is to outreach and collaborate, and this is by engaging other medical specialties within the medical physics community, defining educational platforms, and this is by utilizing conferences and webinars for visibility, recognition and celebration. We have to recognize our community, our medical physicists and other specialties, and to celebrate our medical physics day, and this is by acknowledging achievements to inspire, engaging beyond the clinical practice by involving other sectors, and definitely be part of an integrating multidisciplinary team approach. This will solidify the role of medical physics in the healthcare sector. If this will have an impact on the healthcare, and definitely will lead to growth of the profession. So as a MEFOMP member, as a MEFOMP, we should call for more support to support the initiatives, to participate and share, to collaborate across the disciplines, and also to educate the public of our profession. And thank you.